Good afternoon, and we're called to order the meeting of the Rutherford County Benefits and Insurance Committee. And we have prepared a copy of the minutes of the last meeting. Do we have a motion? Motion from Ms. Hickerson and a second from Ms. Boney. Any additions or corrections? All in favor, then please say aye. They were an elongated set of minutes, I believe, last time. I hope you all read them carefully. All right, if there's no other changes required there, all in favor, please say aye. Aye. Any opposed? Thank you very much. All right, Ms. Stinson, you may tell us about the financial condition of our insurance program.
Okay, we'll begin with Fund 264, if you'll go to that report. For the month of March, our per employee per month through our self-funded claims averaged $1,135 for a year-to-date average of $884 compared to prior year of $811. When we combine our on-site medical clinic experience, our per employee per month increases to $1,173 compared to prior year of $779 for a year-to-date average of $919 compared to prior of $846 for an 8.7% increase. And obviously we saw our higher utilization and costs within our clinics as well as our medical plan as some of the costs for the biometric screenings rolled into the billing cycle for March. So that would be something that attributed to that increase in cost.
Is there any other discussion? Are you going on to your next one? No, that's
Yes,
only
sir.
one of them, right?
Right. Moving on to Fund 266. At the end of March, our OJI workers' comp program is at $1,327,146 compared to last year of $617,893.
Okay, do you have any questions on either one of these reports? Okay. All right, so we just record this as information unless you have any questions. Now, Mr. Good, are you going to tell us about our workers' comp and OJI?
Good afternoon. The report you have in front of you is for the period ending March of 2014. You'll notice that for the month of March, we had a total of 16 injuries requiring medical attention. That brought the year total from January the 1st through the end of March to 55. Of those 55, 26 were recordable injuries under OSHA. 19 of that 26 had restricted days, 4 were lost time days, and 3 others. On the next page, you'll notice when you look at the graph, you can compare this year to the 2 previous years. And out to the right-hand side there, you'll notice that this same time in 2012, we had a total of 39 injuries, 2013, 52, and 2014, 54. So we're about even with where we were last year at this time. The total dollars for the 16 injuries for the month of March were $24,290. And that's with the incurred dollars. The Board of Education had 10 of those injuries, and the total incurred dollars there were $12,990. The County General had the remaining injuries of 6, and the incurred dollars there were $11,300. And next page of your report there, when you look at that, you'll see in the County General where those injuries were between Sheriff, Ambulance, and County Clerk's Office. The last page of your report presents this year's dollars compared to the 2 previous dollars as first. Dollars incurred. This time in 2012, you'll notice we were at $114,000, last year 89, and this year 84. So as you look at this, the incurred dollars at this time is less than last year, even though we've had a couple more claims. And that would just tell you that the severity of the injuries for this year is down from where it was last year. Now, I always like to caution you to remember that those incurred dollars fluctuate depending on the treatment, and it usually takes 6 months to a year for those to mature and settle down. Are there any questions?
No questions for Mr. Good. Thank you
Thank you.
again for a good report. Now, Ms. Perrion will tell us about our wellness status.
Hi. The April Wellness Report, right now we have 2 programs going on. Intune is a stress management program that is online. It's 6 weeks. It started April 7th and it goes through May 16th. We have 37 people that signed up. Over the course of the 6 weeks, it just identifies your stressors, identifies your triggers, and gives you tools and techniques to help lower your stress. MedPoint has a Way to Go program. It's a weight management, and they have 33 people signed up for that, where they come in and speak with a doctor, and they can talk to the wellness specialist and do nutrition counseling. And I think that that's like a 12-week program, and it kind of rolls depending on what your start date is. In March, there were 12 total wellness coaching visits with 7 active patients. Current upcoming activities: the mobile mammography unit from St. Thomas is coming back to Blackman and Stewart's Creek Clinic on May 7th and 8th. You can schedule an appointment for that at 222-7644. It's free to anybody that is covered, and it takes about 15 minutes. And if you want any more information, you can contact me by email or check our website. Farmers Market opens May 9th. Fight for Air 5K, the American Lung Association's main fundraiser for the year, is on Public Square Park in Nashville on the 17th of May. And our webinar from Life Services for May is Who's Watching the Kids? And it's online May 20th. You can register to see that at 11 or 1. Any questions? Thank you, guys.
Thank you again, Ms. Perrion. Now we're ready for agenda item 5, CCMSI renewal. And Ms. Stinson, who's going to take the lead on this discussion?
Ms. Janet Bowman will be presenting on behalf of CCMSI.
Good afternoon, everyone. You should have a packet in front of you that looks like this. We'll just go through this if you don't mind. I will say at the very beginning, your renewal is pretty straightforward this year. Unlike some of the other years, it seems to be a little bit more complex. The good news is the rates are exactly the same as they were last year. The limits, as far as your casualty insurance goes, exactly the same, and your retentions are exactly the same. So that's pretty much it in a nutshell, but we'll kind of go through it step by step. So that's the good news on the front end. The very first page is just basically comparing the exposures this year from last year. You'll see at the top, the very first is the property coverages. We break those out as we've done in the past. The first portion is the county. You'll see the building values there and the contents values. You'll see the difference in the percentages of increase on the values to the far right, and then the difference as far as in the next to last column, you'll see the difference in total dollar values. And then the schools are right below that. If you go on down to what's highlighted in the yellow, the total insured values, that includes all the building and contents plus the miscellaneous equipment. That would be like the highway department equipment, fire department rescue, musical instruments, anything to do with the schools. All that would be included in your inland marine coverage. One of the things I will point out there, you'll see under the miscellaneous equipment in the red, the $5 million difference there. Some of that pertains to equipment with the fire department that was actually rolled into the contents. So I didn't want that to be alarming to anyone. But you'll see the property and the inland marine is up around 3%. You'll see the difference it's around $30 million is where the increase is total. Right below that, you'll see the casualty portion in that purple. And these are rating bases that the excess carrier looks at when they're looking at your renewal. This is the rating basis. This is the reason why we kind of point these out. The vehicle numbers from last year, the expiring was 662 vehicles. This year at the renewal, 687, so an increase of 25 vehicles or 4%. You'll see the auto physical damage values went up around $1.6 million, and then, of course, the general operating budget. The next section in blue is how the crime, public officials, and educators' legal liability is underwritten. It's off of the number of employees and based off the number of students. Increase there for the number of employees is up around 9%, and then the number of students around 6%. The next page goes into the specifics of the property and inland marine coverage. Same insurance company, which is Travelers. Y'all have had that insurance company for several years. Again, the limits, retentions, and everything exactly the same. You'll see the rate is exactly the same, the 0.396 per 100 of value. You'll see in the blue there your expiring total insured values at $1,092,835,070. And then you'll see the expiring premium there in the kind of the light green. You'll see your rate is exactly the same as it was last year, and then you see your current TIVs, which is total insured value of $1,123,651,905, and then your quoted premium. So basically, your exposure increase is up 3%, which then in turn is going to make your premium up 3%, which really there is no difference. It's strictly an exposure increase. If the exposure had remained exactly the same, your premium would be exactly the same. As far as the inland marine, those values are exactly the same along with the retentions. I will say this, under valuable papers, about 3/4 of the way down, I just noticed that the column's kind of cut off. That is actually a $10 million per occurrence with the $10 million limit, so I apologize for that. The next page provides the casualty lines of coverage. You'll see the casualty right below in the yellow. It itemizes exactly what makes up the casualty lines: your general liability, law enforcement, public officials, employment practices, educators, legal, auto liability, auto physical damage, sexual abuse, sexual harassment, and the crime coverage. Brit Global, same insurance company that wrote you guys last year, is on the account again this year. The limits are exactly the same. The retentions, again, are exactly the same. So you'll see in the kind of, again, the green, your expiring premium and then your renewal premium. The rating base was up around 6%, so your premium is up for that 6%. Again, just basically the exposure increase. Are there any questions?
I have one comment. You have the optional quote here, and you provide that annually, and we typically discuss that and take a vote on that as well. Last year, we did not purchase this optional insurance, but you have provided a quote for their consideration again this year, so you may want to explain what that actually is.
That's right it's at the very bottom in the yellow. That's your TRIA, is the Terrorism Insurance Act from the federal government. And on the casualty lines, you'll see the premium to the far right, $6,415. And it basically has to be an act of terror that the federal government deems that it's an act of terror. If it's not, it would not be covered under the TRIA Act. I don't recall in the history that I've handled Rutherford County that y'all have ever purchased that. On the casualty portion, you've purchased that, and it's included in a portion of the property, but not on the casualty side. But that's what that optional quote is.
Ms. Stevenson?
Is that for all the equipment, buildings, and everything that we have? Would that be covered for that amount? Is that what that's saying?
No, this is just for the casualty lines. Yeah.
Okay, anyone have any other questions of Ms. Bowman? Okay, so when is this renewal effective? July the 1st. So we need to take some action on this, and whatever action we take, we need a motion, if we have one, to approve all this, with the exception of not including the optional quote for TRIA. Summarize it pretty much.
I'll make a motion to approve the renewal and omit the Terrorism Risk Act quote there.
Okay, and do we have a second? Mr. Hester? Other questions or discussion? So our premiums have gone up just a bit, but it's because we have more things that we have exposure for, more equipment and buildings, et cetera. Any other discussion? All of you then in favor of this, please say aye. Aye. Are there any opposed? All right, that's good, and appreciate your help with this, Ms. Bowman. All right, we next have on the agenda a quarterly report from Walgreens regarding our MedPoint Health Centers. And Ms. Asherbrander will give us that information.
Good afternoon, everyone. You have your slides in front of you, and I want to thank you for allowing me to present the fourth quarter of 2013 highlights. And this allows you to have a snapshot into the services that are being provided to your team members at the MedPoint clinics. I think you have a set of slides that are in your packet. Our quarterly highlights, looking through, we had over 5,000 encounters in the fourth quarter of 2013, and this is an increase in comparison to the fourth quarter in 2012. We have focused on this fourth quarter on the preventative health screenings, and that is most definitely noted with, we have completed flu clinics at the Blackman's Clinic, Stewart's Creek, and Walter Hill. We started the biometric screenings at the MedPoint clinics in September, as a matter of fact, right after about September the 7th or so, with a kickoff on October 1st. We completed the biometric screens at the Walgreens locations in Murfreesboro, Smyrna, and Laverne. And we also participated with the Rutherford County Health Fair, where there were over 700 attendees, and we provided approximately 420 flu vaccines and did 280 lab draws during that time. On your next slide there, this is a graphic display of the quarterly highlights for the fourth quarter. It gives a running total on the total encounters as well as the penetration rate for the clinics, and also the net savings summary. It also gives the top 5 diagnostic categories for the quarter, and you can see there the percentage of services are very high on the list of the diagnostic services. You'll also see that number 5 is hypertension. And looking through further down into those diagnostic categories, you will still see the diabetes, you will still see hyperlipidemia and those categories also. But the preventative services with the biometric screens brought those totals up to where they were the top diagnosis field. Of the 5,151 unique patients accessed the MedPoint Health Centers for the year to date, which yielded a 44.4% penetration rate. So it means that person has been counted only one time all year long. So even if they've come back several times, the penetration rate only yields one person. And the nice part of this is when you look back since the inception, since September the 1st in 2011, our unique penetration rate is now at 57%. So we've touched at least 57% of the population at least once through the MedPoint clinics. So this is providing services to your team members, okay, helping to make your health care more affordable. Looking at the next slide on it, I wanted to give you just a snapshot of what your flu savings could be, or based on a study that was done, and that if you had vaccinated 1,500 members on it, your savings through flu that was averted would be over or almost $100,000. And so you provide the flu vaccine to your team members, and that's very evident with the health fair and also the clinics and things that we set up. But it is truly amazing that that provides increased satisfaction with the employees, increased productivity because they're not out with the flu, they're not having to take care of themselves and hopefully others around. You also, looking at the next slide on it, I wanted to provide you part of the information about our fiduciary responsibilities with our performance guarantee summary. And the performance summary guarantees looks at certain key indicators that says patient satisfaction. It looks at the clinical care that we're providing. It looks at our budget to actuals. And you can see from the performance guarantee results summary that those performance guarantees were met, okay, and they were achieved, which means that we have increased patient satisfaction and we're meeting our budgetary responsibility. When you are looking through, the last one is, I wanted to include this, is our cultural beliefs. And this is important to you because the cultural beliefs are what we believe in as a company. And we bring those to our employees, and we want our employees to embrace them, and we encourage them to be one and be real and be bold, build trust, okay, with their patients, to love customers, to own it and to live it. And when we are working through with this at the clinic, it helps improve the patient experience at those clinics, because you all have been into places to where all of a sudden you're just not comfortable, you really don't want to be there, and you just have to be there. But if you don't feel good and you walk in and somebody says, come on, it's okay, we'll take care of you, and greets you with a smile, then that experience is one that, yeah, that's home, okay, that's fine. So I have recognition that's been given for one of our providers. Her name is Carla Adams. She's a nurse practitioner at Walter Hill. Recognition was given to her for love customers. In the statement on the recognition form, it says, goes above and beyond in the practice of health care and in the scope of provider by providing appropriate care and then following up with the patient to ensure they're receiving the specialty care they need and reinforce that she cares for the patient as an individual. I have literally been in Walter Hill and had patients come in, and when they walk in, Carla's face lights up. Even if they don't feel good, they're trying to smile, okay? And she just takes them right in and they're taken care of. You know that they enjoy being there and they know she'll take care of them. I brought just some statements also, which I call my happy list from Stewart's Creek. Now, and I know this seems a little bit funny, but this is important to you because this is showing your team members' satisfaction with the services they're being provided, okay? So one of the patients was so impressed with the service at Stewart Creek that she brought homemade salsa for everyone. Okay. Homemade salsa, that means they're part of the family, okay? Another patient complimented on how nice the clinic is and how friendly everyone is. Another patient loves the service at Stewart's Creek so much he randomly just brings coffee for everybody. I'm going, okay. One patient voiced his appreciation of how Stewart's Creek is always available and are willing to work him in. And that is appropriate. Stewart's Creek is our walk-in clinic, so we should be able to get patients in there. But he was very appreciative of that. Another one called to say that she was appreciated the fact that they were able to, again, call, okay, and get somebody in and not having to work through. We've had compliments on the lab services and bragging from patients who presented as a hard stick, but the staff were able to draw their blood in an appropriate manner. And, of course, that is a skill in itself. Most of us know if we're doing that. And that's looking at it from one side, but then our provider, our medical director, Dr. Tansy Doodley, and of course she's board certified internal medicine, she's been able to bring service levels at the clinic up to they were already at a good level, but to me they're even better, okay? Because of her expertise, she's been able to work with the nurse practitioners, help them grow their skills and provide better care. And she actually saw a patient for idiopathic hypoglycemia, which is blood sugar is really, really low. And she suspected that it was NIPH, which is a rare syndrome related to the patient's remote history of a gastric bypass surgery. And the patient was referred to a specialist that dealt with this type of critical issue. Well, when I brought this up and was providing this, and Dr. Dooley said, but that looks like I wasn't doing my job. And I looked back at her and I'm going, oh no, that's telling me that you were doing your job. Because you identified something that, yes, that you would not be able to take care, but you identified it and got that patient to the place that they needed to be. and somebody else may not have been able to. So the value that you have in the MedPoint clinics is truly a valuable service that you provide to your employees, to your team members. Thank you very much for allowing us to do that. Any questions?
Any questions or comments from some of you that probably are using this service more than others? Okay, Ms. Harvey.
Thank you for your report. When you talk about the different services you provide, you said that you see diabetics quite often and those type of things. When you supply, I know y'all keep a supply of medication and things there for the patients to use. Is that based on what the needs are of the patients that come in? I mean, like if we have lots of diabetics that use the clinic, I know you have oral medication there, but do you have things like insulin or meters or those type of things that might help the diabetic patients?
The insulin we do not keep in stock. That is set up so that really needs to come from a pharmacy just to maintain the integrity of the medication. The meters and the glucometers and things, we do have samples of those, and Kelly can help, or one of the nurse practitioners and nurses can help the diabetic understand how to use those and to work through that. So that works out well. The other thing, too, is with the diabetics is that we actually can take care of those patients at the MedPoint Clinic. And I said with Dr. Dooley being an internal medicine specialist, board certified, then that helps to bring that level of service up to an even higher level. Now, we will refer out to a specialist when it's appropriate, okay? And our specialty referral rate is less than the national average, okay? Less than the state average, which is as it should be, because we want to keep as much as we can internally, but at the same time, make sure that it is the appropriate things that we are keeping internally, okay? Any other questions?
All right, thank you, Ms. Asher-Brenner.
Thank
you. Okay, is there any other business? Ms. Stinson?
No, sir, not today.
Anyone have any business on the committee here? If not, thank you very much. We are adjourned.